Hi everyone, Mayor Steve Allender here. It's March 19th, little update. We've had our city government meeting this morning, which includes all of the city department heads, 12 of them, city council leadership, and we discussed our update for the past 24 hours. And here's a snapshot of it. First of all, we're going to put up a page on the city website specifically for the coronavirus or COVID-19 communication. We're going to try to funnel all of the city communication into one channel so that we're not inundating you and making it impossible for you to absorb all the communication. So a brief update. Yesterday in City Hall we had about 100 walk-in customers here wanting to pay utility bills. And we're urging everyone to put a stamp on those bills and mail them or sign up for online payments. But we're probably looking at closing down City Hall to public access by next week. So that'll be important for you. We're also going to close the playgrounds and the parks. I know that sounds like a bummer, but yesterday the weather wasn't even that great and we had dozens of kids out there using the same slides and the same equipment. So we're going to cordon those off and close those restrooms in those public parks. All of the Civic Center events have been canceled currently through April 8th and waiting on more cancellations. The Rapid City Library is still closed. The police department has been very busy. The robberies have been up the last few nights. The fire department ambulance, their calls for service has been up as well, and they're doing a lot of screening for coronavirus-like symptoms. They're encouraging the following of the CDC criteria for isolation. Our building permitting and all of the services from Public Works and city planning will be reduced to handling that over the phone or online. And in some cases where materials need to be dropped off or transferred physically, we'll make appointments and we'll meet those customers at the door of City Hall. And there'll be a more complete communication coming on all of this. And we're working on our technological solutions here for public meetings. Right now we have the public attending city council meetings. They come in for public comment or to listen to items. So we're looking at a way to use conferencing and email submissions for public comment to try to limit that public involvement as much as possible. So it's a temporary thing. We are working on it and we're in close contact with medical professionals. There is some dissension on the issue of whether or not we should close down the city, prohibit unnecessary businesses from operating, and policing large crowd sizes, crowds over 10, and so on. And that's a very sensitive decision. We've made the decision to wait for the evidence of community spread of this virus. That's what the other states that have made statewide notices of this have done. They've waited for community spread to be evident. We're in South Dakota. So far we have 11 positive tests. We have no indication of community spread. And so we're going to wait for our team of clinical physicians to either through the state testing results or through the local hospital system criteria to give us the indication that it's time to take more serious action. So we're just not doing it right now because there will be no such thing as a 2-week closure. Pretty clear to see that the circumstances with the virus are not going to be better in 2 weeks so that we would open up all those businesses again. Probably not in a month, but who knows what the future holds. So we're considering that the actual closing of private businesses by the government could mean permanent closure and a number of bankruptcies and not just economic impact, but economic disaster locally. So you can see we can't just go with a gut feeling of someone that we all need to be under martial law. We have to use some evidence-based procedures. We have a good system in place. We're not taking this lightly. and we will take action when it is warranted. But for now, we're just going to ask you to stay out of restaurant dining rooms, stay out of bars where there are more than 10 people, stop frequenting the places that are frequented by a lot of other people. Protect yourself, and therefore we can protect our community. As I said yesterday, the government will not be the savior in a pandemic like this. It's going to be on the shoulders of every single citizen, you and me alike, to do our own individual part to slow the spread, to maintain health practices and hygiene practices, and to be an example of calm in the community. So thanks for checking in. That's the March 19th update, and I will talk to you again tomorrow. Thank you.